I'm Sophie O'Connell. I'm a private practitioner in the Illawarra-Shoalhaven area. I was invited last year to be a part of the MSSD project. So in my private practice I work with children who have a variety of communication disorders and decided that I would like to be involved in the MSSD project as well. Okay, I've worked in 2 schools for the MSSD project. The first school is at St Michael's in Nowra, and that had a few phases of the service. So the first phase was some assessment of students, followed by some staff development, which occurred just prior to assessment to help identify students, and then some intervention staff development ideas. And then I was able to work in some classes and work with some SSOs to support children in groups. The benefits to the program have been better access of service to children, so they could access now a speech pathology service, and from my perspective that's quite critical in the Nowra area, which has long waiting lists. Second perspective is to provide teachers with skills that they can reconsider how they approach a child with a speech and language difficulty. The benefit to the staff member has been actually having some practical ideas of what types of activities they could do for different children with language needs especially. And the benefit of having the time and allocation to demonstrate some of those activities, but more so to take it a step further and collaboratively plan what to do, what strategies, what activities suit the children that have been identified in that particular classroom. And the feedback from the staff members has been that they have really liked the opportunity to have that time in the classroom setting, and they would love to have had that opportunity for their colleagues. They felt that they were very selected and pleased that they were involved and wanted to be able to have other colleagues have that opportunity. One of the other key focuses for the Nowra School, St Michael's, has been the involvement of SSOs. They were trained, and quite specifically over a period of sessions, and a number of them trained, and are now very, very competent. They could now follow a speech pathology program, collect data about the child's progress, which is quite critical, because that then allows them to know when to liaise back to a therapist about troubleshooting around problems. I think that's important for them, knowing what are their boundaries and where they might need to seek support. The success to the students is that observing and on retesting, those students have made quite significant gains. So without that time of small group and one-to-one, some of the students probably wouldn't have made as many gains. So that was really positive, and the staff, I think, feel quite confident about being able to follow strategies and ideas and programs from the therapist. The other school that I was involved in is Nazareth in Shellharbour. Some of the key benefits to Nazareth have been the allocated time to staff development. The staff were very much able to take ideas, even prior to classroom visits, about how to consider to support a child with language difficulty. And staff were able to pretty much fairly quickly implement a range of ideas. So I think staff development at the right time for certain staff members can be really effective in their setting. Another highlight has been the way that for students who have been supported with the small language group work, plus the classroom visit, have made notable changes. And for some students it's had an impact on their academic outcome. So one of the students, or a couple of the students in one particular class that I was able to work with, staff had noted quite significant change in that child's ability to seek clarification, request help, stay on task, actively listen, all pretty critical things for learning, and that's been really positive.